Leena, if we specifically talk about pregnancy, how do you think malnutrition during pregnancy affect the health of both the mother and the child?
This is something which I have faced myself as well. Not malnutrition. I'll talk about it a little later, but malnutrition during pregnancy affects the health of both the mother and the child. Okay, and it can lead to the increased risk of complications during childbirth, such as hemorrhage and infection. It can also weaken the immune system and increase susceptibility of to different illnesses for the child. Malnutrition in utero can result in low birth weight of the child because the mother is not getting enough nutrients. So the child that is born is, has a lot of deficiencies and low birth weight, which is also associated with a high risk of infant mortality. And statistics have shown that, around 30 to 40% of the women who give birth in the rural areas who are malnourished, their child are born dead. So there is a high rate of infant mortality there, as well as long term health issues, such as stunted growth, cognitive impairments and weakened immune system. वो बच्चे ज़्यादा बीमार रहते हैं बार बार, ठीक है, they cannot concentrate, they are slow, and it can also predispose the child to chronic diseases later in life, such as obesity, diabetes, cardiovascular diseases. Overall, proper nutrition during pregnancy plays a very crucial part, and for both the mother and the child. And the thing that I want to discuss regarding my thing was that what I have read a whole subject on nutrition, pre-post natal nutrition, and how the health of the mother and the child are interrelated. So basically what happens is that if you are a well nourished, well balanced diet taking person, right, your child starts growing inside you. Now he or she is going to take all the nutrients that are needed for growth while they're growing inside you for 9 months. They're going to take your calcium, your vitamins, your minerals, protein, everything, right? So a person like me gives birth to a healthy child, complete with a healthy birth weight, everything. And everyone's happy and everyone's like, okay, fine, life moves forward. Now the mother, even in urban areas, for example, I myself, right, I'm talking about myself, you need to understand that वो कहते हैं ना 40 महीने का छिला लो, उसमें न्यूट्रिशियस खाने खाओ, पंजीरी खाओ, दूध पियो. Why? Because the woman has given birth and given away all her nutrients, not all, but a wholesome amount of nutrients to the child who was growing inside her. Now she has deficiencies. She would have lost calcium in the process. She would have lost, iron in the process. Like in my pregnancy, I was supposed to take iron drips because I was, having iron deficiency, and the doctor, injected the drips. And after I gave birth to my son, I started having, issues in my knees. Though I was only 29 years old, but there was this calcium deficiency. So we, even the educated population forgets the fact that the mother needs to be nourished as well. अगर बच्चे को माँ ने दूध भी पिलाना है या बच्चे की ख्याल रखना है, उसका बड़ा होते हुए हेल्दी फूड उसको देना है, तो जिस माँ ने उसको पैदा किया है उसको भी अपने न्यूट्रिएंट्स पूरे करने हैं जो उसने बच्चे के अंदर किए हैं. And that is the reason it's usually said, don't have another baby right away, because your body needs some time to heal. It needs some time to gain back all those nutrients and vitamins, so that you gain a healthy state. Only then you're supposed to conceive the next child. And in rural areas there's no such concepts. वहां पर 12 बच्चों की लाइनें हैं जो कि एक साल के बाद भी नहीं, कुछ महीनों के डिफरेंस से पैदा हुए हैं, ठीक है. और वहां पर जो एक मदर है, उसके अंदर ऑलरेडी शी वाज malnourished, the child born was malnourished himself, so the next child is even more malnourished, and it results in the mortality. It results in sometimes a lot of women die during giving birth because their body cannot take that pain because they're not that healthy. So it's a very sad reality, but this is the world that we live in, and we don't focus on the fact about how important the intake of food and micronutrients is important for the mother and for the child both.
It's true. It is sad, but It is true. Women go through so much physical pain during a lifetime. How do you think it connects to their mental health? How do you think, what is the long-term health consequences of malnutrition in women, and how does it contribute to their mental health issues?
Well, malnutrition can actually, lead to various long-term health consequences, not only the mental health, but, consequences like osteoporosis, because of the inadequate intake of calcium and vitamin D, which can weaken the bones, like I mentioned before, leading to a higher risk of fractures and, then, osteoporosis. Then the second one is anemia, which is the iron deficiency, which can, result in causing a lot of fatigue, weakness, and, decreased immune function. Then reproductive issues, conceiving again. Malnutrition can disrupt the menstrual cycle of a woman, impair fertility. It can increase the risk of complications during pregnancy, the second one, and even childbirth. Cardiovascular diseases as well. Poor nutrition can contribute to the development of heart disease, hypertension, and stroke. Immune system impairment and inadequate intake of essential nutrients can weaken the immune system, making the women more susceptible to infections and diseases. And mental health also plays a very very important role. And mental health may matlab, malnutrition can have negative effects, because it can function to the mood. For example, you're tired, आपका mood अच्छा नहीं है, and which leads to anxiety, which leads to depression and other mental disorders. PPD, which is very common. I went through it, postpartum depression. uh, you know uh, in even in the urban society, people don't agree with such a concept. And they're like, I mean, depressed हो रही है, अल्लाह ने बेटा दे दिया खुश हो, अल्लाह ने औलाद दे दिया खुश हो. They don't understand the fact that this is something serious, and it just increases. The more you don't treat it, the more it will increase. And the micronutrients do play a role, because they are affecting the functioning of your brain, your cognitive functions, etc., right? So if you're low on certain vitamins and minerals, or आपका एक imbalance create होता है, that causes depression, that causes anxiety, and it can turn into something severe. Like you can have chronic depression, you can have anxiety attacks, and it can get serious. So you need to make sure that you are well nourished during pregnancy, you are well nourished after pregnancy, and you just don't only focus on the macronutrients like carbs, protein, and fiber, etc., but the micronutrients, because those minerals are the things that are causing the balance of different sodium, potassium का balance है हमारी body के अंदर, वो जरा सा disrupt होता है ना, तो it leads to mental fatigue, it leads to depression as a whole, and that leads to bigger problems in the future. And addressing malnutrition through a balanced diet, nutrient supplementation, and healthcare intervention is crucial to prevent long-term health consequences. Like I still remember when I was hit with postpartum depression, because I was well aware of the fact. Initially I just thought that maybe I'm just overthinking it, right? But then I got myself checked by the doctor. She said कि ऐसे आपको कोई deficiency इतनी extreme नहीं है, calcium का intake आप लो, but you're going through depression, you have this thing is constantly nagging you, you should look into it. So she instead of advising me some depression की medicines जो आपको सुन कर देती हैं or something, she told me अपनी diet अच्छी करो, she told me workout start करो. I had a C-section, so I couldn't work out till at least a year, but still मैंने slowly थोड़ा थोड़ा walk करना शुरू किया. I spent time meditating, ठीक है, and then I started taking supplementations. Overall जो multivitamins होती हैं उसके अंदर they cover a large range of minerals and vitamins. So we should take that. I'm talking about the urban population, because rural बेचारियों को तो पता नहीं normal दूध भी मिलेगा नहीं, पीने को नहीं मिलेगा. But women in general should look into supplementation. They should, if they cannot access, like if there's like some women, I know a lot of women who are like हम दूध नहीं पी सकते, उनको lactose intolerance भी नहीं है, but they cannot, they're like हमें दूध नहीं अच्छा लगता, ठीक है. So for such, nakhreeli women, or the women who in general may be lactose intolerant, they cannot, they can rely on, other sources, because sources, सबसे पहले direct source nutrition का is the most important point. If you have access to milk, दूध, दही, ठीक है, तो सबसे अच्छी सोर्स वो है आपके न्यूट्रिएंट के इनटेक की, विटामिन के इनटेक की, डार्क लीफी वेजिटेबल्स व्हाटसोएवर. बट if you think that you don't have time on your hands, or you think that you're too lazy, then at least add a good multivitamin there in your diet, so that वो at least आपकी वो deficiency को पूरी करे. Iron में, my fall is like one of the common ones. For the general multivitamins, one a day is something that I use. There's Centrum out there as well. So try to incorporate that vitamin or mineral through some source or the other. For example, like I suggest women above 30 years, or the ones who've given birth, to at least have one sunny D, vitamin D3, because हम लोग सन के अंदर जाते ही नहीं है, हमारा एक्सपोजर बहुत कम है, तो बहुत नहीं, 95% women suffer from this vitamin D3 deficiency. So I suggest them to consume one capsule in at least 2 weeks. ठीक है, एक आपने खानी ही खानी है हर हाल में. दैट इज वेरी इंपॉर्टेंट. सो इसके अंदर सप्लीमेंटेशन का पार्ट है, मेंटल हेल्थ के रिलेटेड भी सप्लीमेंटेशन, उनकी माइक्रो न्यूट्रिएंट्स की फुलफिलमेंट जब होगी, दो द वुमन वुड फील बेटर. डायरेक्टली जाके साइकियाट्रिक मेडिसिन लेने की जरूरत नहीं है. हम लोग हमेशा न्यूट्रिशन में जो है ना, न्यूट्रिशन इंटरवेंशन पहले करते हैं कि हम फूड के थ्रू किसी का मूड कैसे एलिवेट कर सकते हैं. और बहुत सारे लोग इस बात पे हंसते भी हैं, बहुत सारे लोग इस बात को ऐसे एग्री भी नहीं करते, एंड दे से ये भी फजूल बात कर रहे हो आप. But these micronutrients and vitamins are what are maintaining the balance of nutrients in your body, the different hormones and nutrients and vitamins in your brain, around in your nervous system, which are keeping you sane, which are keeping you happy, which are keeping you in a normal state.
Talking about foods that can boost your mood, one of those examples is bananas, right? They can immediately
Yes.
boost your mood. So the next question I would like to ask, based on your diverse experience, what are some common misconceptions about women and nutrition?
Okay, this is a very good question, because I love addressing this question, and I have talked on this topic with so many people, and I always have more misconceptions added to this topic. Certainly, there are few misconceptions about women nutrition. For example, one size fits all, right? Assuming that all women have the same nutrient needs in common. This is a misconception out there. For example, you give birth to a child, I give birth to a child. I might be having a calcium deficiency, you might have an iron. So assuming that तुम्हें भी iron दो, मुझे भी iron दो, तुम्हें भी calcium दो, मुझे भी calcium दो, is not the same thing. You have to get your nutrients checked if you have the access to a health professional. Okay, you have to understand that sometimes ऐसे होता है, girls from a very early age, they stop consuming milk. मोटा हो जाऊं, मैं मोटी हो जाऊंगी, मैं मुझे हो जाएगा, मुझे वो हो जाएगा. Teenage girls nowadays have this a crazy amount of increase in calcium deficiency. So you need to understand that not every person would be having the same issue, right? Then factors like age, activity level, reproductive status, overall health, they play a very important role in determining an individual's nutritional requirement. For example, I am a very active person, so I have serotonin in my body. It elevates my mood. If you are a person who has a sedentary lifestyle, you have a 9 to 5 job, you sit in a bank, so you might have vitamin D3 deficiency because you don't have exposure to sunlight. You are inactive, so you might have more fat in your body. You might be overweight or obese, or have an unhealthy body mass index, which is BMI, right? So it differs. There is there is no hard or fast rule in that, right? Then weight loss, for example, focus as well. For example, if you seem a little overweight to me, does not mean कि I force you to start working out. तुम्हारा तो बहुत weight ज़्यादा है. You get it checked yourself. Maybe you do seem a little bulky, but you have a healthy BMI. Maybe it's just the way you're built, right? So there is no one rule that applies to all the women. Okay, then many assume that women's primary concern with nutrition is weight loss, but in reality women have a wide range of health concerns, right?